Hello, this is over on Cloud 91, and this is my psychology paper. This I have in my hand right here. I mentioned in my Oblivion Let's Play that I was going to be reading this at some point. I also mentioned that I'm not particularly proud of this paper because I don't feel that it's a reflection of my actual ability to write. I had some problems with it. Procrastination being a major problem, but I'll get into that. The paper is Asperger Syndrome and Adults in Higher Education, because as you know, I am big on Asperger Syndrome and autism spectrum disorders. I love talking about it, especially if it makes it so that I know more about it than I did before. You can get some. If you have Asperger's, and you yourself don't really know much about it, take advantage of opportunities to talk to other Aspies out there. I just bumped into one a couple of weeks ago. So we talked briefly, and she made an interesting observation that people with Asperger's, what's different about them is that it's like everybody who doesn't have Asperger's understands the rules of social engagement. They understand the rules and they effortlessly engage in conversations by them. But the thing with people with Asperger's is that they don't understand the rules of engagement, which makes conversation more difficult. That I just picked up in conversation. I never actually applied it to myself. It was interesting to have that kind of self-reflection for a bit. But anywho, my paper, Asperger Syndrome and Adults in Higher Education, by Noah Fraioli. Asperger Syndrome, AS, or Asperger's Disorder, AD, is a developmental disability that resembles mild autism, and as a result has been categorized as an autism spectrum disorder, or ASD. Today, more and more people with AS have entered into higher education and the professional community, where they suffer from constant impairments in social functioning and a need for repetitive routines and rituals. As a result, this population requires support akin to that which we provide for people with autism, especially considering that people with AS tend to follow a similar trajectory in life to people with autism. The disorder was first described by Dr. Hans Asperger in 1943 when it was labeled autistic psychopathy. During the 1980s, American psychologists translated Asperger's work into English and brought it to the attention of the entire psychiatric community. In 1994, the American Psychiatric Association, or APA, included AS in the Diagnostic and Statistical Manual of Mental Disorders, DSM, when it became an official diagnostic label. Since its addition into the DSM 4th edition, the incidence rate for AS globally has risen to more than 1 in every 280 children, with a 4-to-1 ratio of boys to girls. Although the exact causes of AS are unknown, research suggests that it has both genetic and environmental origins, much like the origins of autism in general. Quote, association studies and mutation analysis of candidate genes have implicated the synaptic genes A, B. I'm not going to read the genes. Just know that they're there. There's 5 of them. There's 5 genes, and they're all related to ASDs. End quote. However, there are no known risk alleles that indicate with certainty that a child will develop an ASD like AS. Parents of children with AS prior to diagnosis often report that their children develop language normally, though these reports are not totally reliable, especially when an adult seeks an AS diagnosis. However, around preschool age, when children are subject to numerous opportunities to interact with other children and adults, the more debilitating symptoms of AS emerge. Teachers often observe children with AS spending time by themselves, away from the other children, who can subject them to a significant amount of auditory and visual stimulation. They also have a tendency to fixate on certain repetitive routines or rituals that make them look odd in a public setting. Children with AS are typically diagnosed between age 7 and 11. At this point, the child has developed fully functioning language skills with moderate to severe deficits in pragmatic language and reciprocity, or the capacity to maintain a give and take conversation with other children his or her age. This difficulty, combined with an intense focus in a particular area of interest, often creates a situation where the child can talk about their interests as though he was giving a class lecture. Asperger described most of the patients who exhibited this behavior as little professors. However, not everyone who has AS gets diagnosed as a child. Many adults over the age of 25, with the aid of their families or spouse, seek a psychiatric evaluation in order to understand themselves better. Quote, "Many of these individuals describe themselves as feeling like outsiders when often being excluded educationally and socially and knowing they were different without anyone understanding why." End quote. Wait, where's the next one? Oh, there's the next one. Excuse me. Without proper treatment, significant deficits in social skills and understanding persist well into adulthood and can cause many problems with the individual's relationships with others, his career, and his self-image. Furthermore, these problems can often result in anxiety disorders or depression in individuals. In establishing relationships, people with AS, like people on the autism spectrum, have difficulty understanding the thoughts and feelings of other people due to a phenomenon called mind blindness. People with AS do not readily understand body language, tone of voice, and other nonverbal social cues that people normally read regularly in order to communicate effectively. Eye contact difficulties, which are some of the hallmarks of ASDs, typically communicate that the person is not paying attention or is not interested in the conversation when, in fact, the opposite can be true. Although people with AS may compensate by expending their intellectual faculties so that they can communicate effectively in face-to-face conversations, they are still significantly disadvantaged. The expenditure of such energy can leave them mentally fatigued and weary. Interestingly, the difficulties people with AS have in understanding nonverbal language are similar to those experienced by people with nonverbal learning disability, or NVLD, which have led some experts to believe that these two conditions are similar, if not the same. In the professional world, people with AS also face significant challenges due to deficits in communication skills, especially pragmatics and body language. While interviewing for a job, they use less eye contact, which to the person interviewing them would come off as abnormal nervousness and incompetence. They also cannot easily keep up with the series of interview questions, which is supposed to give the typical interview the air of a guided conversation. Even if they pass the job interview and acquire employment, they must continue to use social skills in order to function effectively with coworkers and supervisors. Many people with AS have lost their jobs due to social blunders within otherwise manageable social settings. Likewise, these challenges become more pronounced under the circumstances of on-campus living at college. Students with AS come under considerable pressure to fit in when they join a campus community, like a dormitory or a club. These same students may display such odd idiosyncratic behavior that attracts the attention of bullies, subjecting the student to teasing, harassment, and other harmful exposure. The difficulties that people with AS have with social functioning and flexibility are much like those that people with high-functioning autism, or HFA, have. People with HFA could have fit the criteria for AS had they developed language at a normal rate. However, due to delayed language development, or more pronounced impairments to social functioning and flexibility, they were diagnosed with classic autism instead. HFA differs from autism in that it typically does not involve mental retardation. Children born with either AS or HFA tend to perform similarly on tests of language acquisition and intelligence, indicating that there is virtually no difference in their ability to develop language. Treating individuals with AS is similar to treating individuals with high-functioning autism. Each treatment is individually based and usually unique for each person. They target the individual's specific weaknesses in social interaction and flexibility. One treatment method recommended for therapists is the Asperger Integrated Psychotherapy Model, or the AIP model. Components of the AIP model include building a relationship between the client and the therapist so that the therapist can teach cognitive behavioral strategies. Overall, AS is best understood to be one end of on the autism spectrum. Therefore, it is crucial that we change our current diagnostic models to match our current knowledge. One such change has been proposed by the APA to officially include AS as an ASD in the DSM-5. This change, and perhaps others, will allow us to better diagnose and treat people on the autism spectrum as they are in need of increased community support. I cited 9 references, and C-. He gave me a C- because it was 6 pages and it was supposed to be a 10-page paper. I felt bad at first that I couldn't perform up to the standard, and because everybody knows, everybody that I know will tell me I have the capacity to do great things as a student. So things like this just doesn't really make sense. I hope that this paper, at least for now, will serve as my baseline explanation for Asperger's syndrome. If, I wasn't asking you guys to take notes, but that's what I just read is Asperger's syndrome in a nutshell, or in a slightly cracked open nutshell, put it that way. So I'd like to thank you guys for watching. I am very glad to have been able to record again. It's my first video in a couple weeks. Thanksgiving break, expect more videos. They will be coming, because I'll actually have time to do them, and I don't have to worry about schoolwork. It is awesome. So, thank you guys for watching. Again, thank you, and I'll see you guys next time.